All right, let's dive in. Today, we're talking about the thyroid. It's this tiny gland that has a huge job. You might not even know it's there, sitting quietly in your neck, but it's basically the master regulator for your whole body's metabolism. We're talking everything from how fast your heart beats to how much energy you have. So, what happens when this little powerhouse goes haywire? And yeah, it's pretty hard to believe, but this dramatic swelling you're seeing, it's all caused by that same tiny gland we were just talking about. So you have to wonder, right? How can something so small cause a problem this big? And what does it even mean? What are the signs our bodies are giving us when this master regulator is in trouble? Well, that's exactly what we're going to get into. So to really get a handle on this, we've got to start with the basics. The body's master regulator. Yeah, that's the perfect place to start. We're going to look at its form and function, the brilliant machinery that lets it run our internal engine. So here it is, in all its glory. It really is this small butterfly-shaped gland, and it just kind of wraps right around the front of your windpipe. And to give you a sense of just how small we're talking, it only weighs about 20 to 25 grams. That's what, like a couple grapes? And yet its impact is felt in pretty much every single cell in your body. It's wild. Okay, the way this whole system is controlled is just fascinating. The best way to think about it is like a thermostat for your body. You've got the pituitary gland up in your brain, right? It sends out this hormone called TSH, that's thyroid-stimulating hormone. And that's the signal that tells the thyroid, okay, time to get to work. But if your thyroid hormone levels in the blood start to creep up too high, the pituitary is smart. It just stops sending the TSH signal until everything balances out again. It's this beautiful self-regulating loop. All right, so how does it actually make these super important hormones? Well, you can think of it like a simple 4-step recipe. Step 1, the thyroid grabs iodide straight out of your blood. Step 2, it changes that iodide into iodine. Step 3, it takes that iodine and binds it with something called tyrosine. And then for the final step, it just couples those new molecules together and voila, you've got your final products, the hormones T3 and T4. Okay, so that's how it's supposed to work. But what happens when that system gets all out of whack? Well, that brings us right here, when things go wrong. We're going to talk about goiters and nodules, some of the most common signs that your thyroid is in trouble. So the word goiter, I know it sounds a little intimidating, but honestly, its meaning is super simple. It just comes from the Latin word for throat, gutter. All it means is a general enlargement of the thyroid gland. Remember that first picture we saw? That was a goiter. The key thing to remember is that it's not a specific disease itself. It's more like a signpost, a big one sometimes, telling you that something is causing that gland to grow. So what's actually causing this growth? Well, in a huge number of cases around the world, the number one culprit is actually just a lack of iodine in the diet. Think about it. If the thyroid doesn't have enough iodine, it can't make its hormones, right? So the pituitary gland senses this shortage and just starts screaming for more, sending out more and more TSH. The thyroid tries its best to keep up, and in the process, it just gets bigger and bigger. This is exactly why goiters used to be so common in places like the Alps or the Himalayas, mountainous regions where the soil just doesn't have much iodine. And it's also why something as simple as adding iodine to table salt has been one of the biggest public health wins ever. And this really shows you what the real problem is. A goiter isn't just about how it looks on the outside. As that gland gets bigger, it can start to literally press on other important stuff in your neck. If you look at that scan on the right, you can see the trachea, that's your windpipe, and it's being squeezed by the enlarged thyroid. I mean, you can imagine that can make it hard to breathe or even to swallow. It's a serious issue. All right, so if you go to a doctor with a swelling in your neck, what happens next? Well, this is where the detective work begins. Your doctor has to gather all the clues to figure out what's really going on inside that gland. Okay, clue number 1 almost always comes from a simple blood test. This table breaks it down really nicely. If everything's normal, they call that euthyroid, all the hormone levels are just where they should be. But check out what happens with an overactive thyroid. The pituitary slams on the brakes, so your TSH is basically 0, but your T4 and T3 are sky high. And for an underactive thyroid, it's the complete opposite. The pituitary is screaming for more hormones, so the TSH is really high, but the thyroid just isn't listening, so its hormone levels are low. So after the blood tests, the next big tool in the toolkit is what doctors call the workhorse investigation, an ultrasound. And there's a good reason for that. It's cheap, it doesn't involve any radiation, and it gives them this incredibly detailed first-person look inside the gland. They can see the size, the shape, the texture, and most importantly, they can spot any specific lumps or nodules that might need a closer look. Now, if that ultrasound does show a nodule that looks a little suspicious, the next step is often something called a fine needle aspiration, or for short, FNAC. I know, it sounds super technical, but it's actually a really simple procedure. Basically, a doctor uses a very, very thin needle, and they use the ultrasound to guide them to just pull out a tiny sample of cells from that nodule. Then those cells get sent off to a lab so someone can take a really close look at them under a microscope. Okay, so our detective now has all the clues on the table: the blood test results, the ultrasound pictures, and that cell sample from the FNAC. So what now? Well, this is where we start decoding the diagnosis and making sense of it all. It's time to crack the case. Sometimes, doctors might use another tool called an isotope scan. And what this involves is swallowing a really tiny, totally safe amount of radioactive iodine. Now, any active, working thyroid tissue will soak up that iodine and literally light up on the scan. But if there's a nodule that doesn't light up, well, that's called a cold nodule. And I know, cold nodule sounds kind of bad. But here's the really good news. About 80%, the vast majority, of these so-called cold nodules are completely benign. They're not cancerous. Okay, but here's where things get a little tricky. There's a really important limitation to that needle test, the FNAC. For most things, it's great. But for one specific type of growth, called a follicular neoplasm, there's a problem. The benign cells and the cancerous cells can look almost identical under a microscope. The only, and I mean only, way to tell them apart for sure is to see if the cells have actually started to break out and invade the tissue around them. And you just can't see that with a tiny sample of cells. You need to see the whole nodule and its borders to make that call. So, that dilemma we just talked about, that leads us straight to our final big question: treatment. Specifically, when is surgery the right choice? How do you and your doctor take all this information and decide on the best path forward? Well, thankfully, the decision isn't just a guess. It's based on a really clear set of criteria. For starters, if that needle test comes back and it's either suspicious or definitely malignant, surgery is usually the next step. It's also recommended if there are other worrying clinical signs. If the swelling feels really hard or if it's affecting your vocal cords. Then there are the pressure symptoms we talked about, if it's making it hard to breathe or swallow. And finally, a couple of other things can point to surgery, like a cyst that just keeps coming back after it's been drained, or even just for cosmetic reasons, or because the patient decides it's what they want. When you step back and look at it, the story of the thyroid is really just an amazing look at the incredible, intricate balance going on inside our bodies all the time. You have this gland that weighs almost nothing, and yet it's running the whole show. And when it starts to falter, it sends out signals we can actually learn to recognize. It really is a powerful reminder, isn't it, about just how important it is to listen to what our bodies are telling us.